I'm Dr. Jacqueline Bezic. I'm a periodontist and a family dentist. I've been in the field of dentistry for 30 years, and from general dentistry to perio, implant, tooth replacement, sleep apnea, when looking at the mouth and the impact of it and the health of the patient is what fascinates me. So today I want to discuss retainers. What is a retainer? As the term applies, it's something to hold something else in place, not letting it to move. So in the mouth, where are the times or occasions that we want to use a retainer? Majority of time, in younger age, you might need a retainer if you have lost your baby tooth soon enough that the permanent one hasn't erupted. So we use a retainer to keep the space, not letting that space being taken over. Later in life, the same thing can happen, that you lost the tooth and we want to keep that space. Or if you have done some orthodontic movements and we are trying to keep teeth from shifting back to where they were. Now, the role of retainer is critical in any of this as how you use it and how fit that appliance is. Because if the retainer is not fit, like a loose shoe, it's not going to function well. So, and if you're not using it frequently enough, it's not going to help you. We get this question all the time. Do I need to use my retainer all day long? Do I need to do it only at night? Is it lifetime? And that brought my attention to have this discussion today, because the key comes from what is your purpose? What is that you want to accomplish? So, for example, in a child case that the retainer is placed to keep the space for the permanent tooth to erupt, as that permanent tooth is starting erupting, we don't need that anymore. Done. Job is complete. If we are doing the retainer for a period of time until we get a replacement of a tooth, let's say we have a case that we have an implant is in progress and you want to keep the space. So after placing the implant and no risk of movement, then we don't need it. But in the cases that we have moved teeth against the normal condition of the body, like you had a crowding, you had a spacing, now you want to keep the shape the way you like, that's when you might want to consider it lifetime. Because your body's way, the genotype, is dictating certain ways. And we see that it happens. Change happens and we see the shifting of the teeth coming in. So now, let's say you have a retainer and you wear it and now you're not sure if it fits or not, and you stop wearing it. One of the indicators are easy that if that appliance, whatever shape your mouth was, is not going in, definitely your teeth have shifted. And that's where you need the professional exam and knowing that what needs to be done. Or if you have a retainer that you left it out for a couple of days and you go back in and it feels like it's too tight. So that's again indicator of the movement. Now, let alone that the appliances can get destroyed through the time. They are materials, like anything else has a lifetime of it. So it's important to get that checked. So if you are in any of the categories and you're finding that your retainer is not fitting or it's too tight, please reach out to your dentist. Make sure that you don't leave it to go too long. Then you might have to go through more long process of treatment. And if you don't have a dentist and you need help, we'll be more than happy to help you. MetroDental Health, we have two locations, DC and Fairfax. Our phone number is 202-363-5720 in DC and 703-934-4474 in Fairfax. And you can book your appointment from our website, MetroDentalHealth.com. And I hope that you will be able to do more preventive care to prevent more expensive or extensive dental treatments. Enjoy your day.